Welcome to Clinical Capsules from TRC Healthcare, your go-to podcast for fast, evidence-based insights. On this episode, Associate Editor and Clinical Pharmacist Vickie Danaher spotlights newly approved formulations of familiar meds, like Arbli, Emrosi, Opipza, and Neffy, and breaks down what pharmacists and pharmacy technicians need to know in an excerpt from our popular Pharmacy Essential Updates webinar series. TRC has been a trusted resource for healthcare professionals for over 40 years, and now we're bringing that expertise straight to your ears every second and fourth Tuesday in bite-sized, actionable episodes, right here on Clinical Capsules. With that, let's get started.
So let's talk about some recently approved drugs and dosage forms that bring some new twists to older medications. And we know it's not uncommon to see new versions of existing meds enter the market, especially as patents expire on original products or to try to meet an unmet need, such as using a drug to treat a different condition or patient population. But as multiple formulations of the same medication become available, it often leads to questions about substitution, how the various products stack up, or how to prevent confusion or errors among the different options. So today we're going to hone in on some notable new products and dosage forms of older meds that many of us are used to dispensing. For example, there's a new version of Losartan for high blood pressure that goes by the brand name Arbli, a new Minocycline product called Emrosi, and a new formulation of aripiprazole known as Opipza. There's also new biosimilar products that have also been recently approved, such as insulin aspart, SZJJ, or Merilog, which is highly similar to the insulin aspart product Novolog, which has been around for ages. All right, let's start off by exploring the new Losartan product Arbli, which will be the first ready-to-use oral Losartan suspension. And you can think of its brand name Arbli to remember that it's an angiotensin receptor blocker, or ARB, or ARB, that comes in a liquid, which begins with LI. Now, historically, some pharmacies have been compounding oral Losartan liquids, especially for pediatric patients with high blood pressure or patients who can't swallow Losartan tablets. But Arbli will be commercially available without the need for compounding or mixing. So this means that you'll likely see patients start to switch from a compounded Losartan liquid to this ready-to-use Losartan suspension. And it's critical to stay alert for these patients because there's some key differences between these products to be aware of. One of the biggest things to pay attention to is the concentration and dose. Losartan liquids that are compounded are often made in a 2.5 milligram per ml concentration. But Arbli is a 10 milligram per ml concentration, so it's 4 times more potent. And a 4-fold dosing error could occur if the volume isn't adjusted. So to help clarify the dose, ask for the patient's weight if the prescription's for a child. The usual pediatric starting dose for Arbli is 0.7 milligrams per kilogram by mouth once daily. Also point out that the Losartan oral suspension has different storage requirements than some compounded formulations. For instance, Arbli should be dispensed in its original container, which is a 165 ml bottle, and it should be kept at room temperature, whereas compounded Losartan liquids often need to be refrigerated. Direct patients or caregivers to shake the ready-to-use Losartan suspension for 20 seconds before each use to ensure the product is adequately mixed, and to discard the bottle 60 days after it's first opened. This is also different than most compounded Losartan products, which are usually only good for 28 days. And then for any Losartan liquid, make sure to dispense an appropriately sized oral syringe or dosing cup to help ensure patients get the right amount of medication, and that they avoid using household spoons, which aren't accurate. And for more on how Losartan stacks up to other meds for high blood pressure or heart conditions, check out our angiotensin receptor blockers and angiotensin converting enzyme inhibitors chart. The next drug we have to discuss is the Minocycline ER 40 milligram capsule called Emrosi. And it's being touted as the lowest dose oral minocycline product for rosacea. Limited data suggests that minocycline ER 40 milligrams improves lesion count and treatment success better than oral doxycycline 40 milligrams or Oracea. But expect that many patients and insurance companies will balk at the price. Emrosi costs about $1,300 per month, and also be ready for prior authorizations. And that's also because many patients with rosacea should often try other measures to manage symptoms and prevent flares, and not jump to systemic meds first. For example, emphasize using non drug strategies such as gentle skincare with mild cleansers, and identifying and avoiding triggers such as alcohol and hot or spicy foods or beverages. Point out that topical meds such as metronidazole or azelaic acid are usually first line for mild to moderate symptoms of rosacea, such as papules or pustules. And then recommend adding oral antibiotics such as doxycycline or minocycline to topical therapy for more severe rosacea, to treat flares, or when topicals aren't enough. If patients do get the new minocycline ER 40 milligram capsules or Emrosi to treat rosacea, take care to avoid mix ups with other minocycline products. And don't automatically substitute amongst these products since they aren't considered equivalent. Let patients know they can take minocycline ER 40 milligrams once daily with or without food, but taking it with food may lower the risk of irritation or ulcers in the esophagus. And remind them to swallow the capsule whole since it's an extended release product. And if you'd like to take a much deeper dive into other meds used to treat rosacea, see our chart, Treatments for Rosacea. Moving along, the next product on our list is chlorthalidone 12.5 milligram tablets, or HemiClor. It contains half, or hemi, as much chlorthalidone than the 25 milligram tablets we're used to dispensing. Now, traditionally, patients who need 12.5 milligrams of chlorthalidone could cut the 25 milligram strength in half to get their dose. But the 25 milligram tablets are not scored, and there may be some patients who can't or prefer not to cut an unscored tablet. So, HemiClor tablets may be an option for these patients. But this does come at a cost. HemiClor costs about $1 per tablet, or $30 per month, compared to about $6 per month if patients split the 25 milligram tablets and take half of that tablet once daily. If you get a prescription for HemiClor, stay alert for look-alike sound-alike mix-ups and avoid trying to abbreviate this medication. HemiClor could be confused with H-Chlor, a sodium hypochlorite product used for wound care. And when patients start or switch thiazides, keep in mind dosing equivalencies to ensure patients get an appropriate dose. For instance, chlorthalidone 12.5 milligrams per day is comparable to indapamide 1.25 milligrams per day, or to hydrochlorothiazide 25 milligrams per day. And for more specifics on these and other diuretics, check out our comparison of commonly used diuretics chart. Let's keep going and chat about aripiprazole, which is now available in an oral film called Opipza. We know that this atypical antipsychotic can be used for schizophrenia, major depressive disorder, and other conditions. And a film dosage form may be an option for patients who can't swallow oral aripiprazole formulations. The films also reach peak concentrations in about 1.5 hours versus about 3 to 5 hours for the oral tablets. But don't suggest switching to the oral film without a good reason, and anticipate prior auths. 30 of the 10 milligram films cost about $2,300 versus $10 for the tablets, $175 for orally disintegrating tablets, or $375 for the oral 1 milligram per ml solution. And if you do dispense the Opipza films, watch for mix-ups among the 3 different strengths. It comes as 2 milligrams, 5 milligrams, and 10 milligram films. Educate patients to dissolve these oral films on the top of the tongue once daily with or without food. Explore our chart comparison of atypical antipsychotics for more insights on aripiprazole and similar meds. Next up is Neffy, or epinephrine nasal spray, for the emergency treatment of allergic reactions, including anaphylaxis. We talked about Neffy in episode 5 of Clinical Capsules back in March, but the new twist now is that it also comes in a lower strength, making it a new option for many children. So the new 1 milligram strength of Neffy is for ages 4 years and up who weigh 15 to less than 30 kilograms, which is 33 to less than 66 pounds. And we can kind of think of this as the junior version of the original 2 milligram epinephrine nasal spray, which is for patients 30 kilograms or 66 pounds or more. Each carton comes with 2 nasal spray devices, and each device is single use only. Point out that each device contains enough medication for 1 dose, and that the device should not be primed or tested since this will discharge the dose. Explain to patients or caregivers to hold the device with a thumb on the bottom of the plunger and a finger on each side of the nozzle. Insert the nozzle fully into one nostril, either nostril is okay, and then press the plunger to give a dose. And then 5 minutes after the first dose, a second dose can be given if needed with the second device. But that second dose should be given in the same nostril as the first. When you get prescriptions for epinephrine nasal spray, ask for and document the patient's weight to double check doses, especially as children grow. Also, watch for mix-ups and continue to use barcode scanning, since the 2 strengths of the nasal spray come in cartons that have a similar looking design and font. Remind patients and caregivers to store them properly, check the expiration date on their device, and make a note on their calendar or in their phones to refill the medication before it expires. Neffy 1 milligram has a shelf life of 24 months, but Neffy 2 milligram has a shelf life of 30 months. Both of the products should be kept at room temperature, but they can withstand temperatures up to 122 degrees Fahrenheit for a few days, such as if they're accidentally kept in a hot car. And we in the pharmacy can also continue following good inventory control practices, such as by monitoring expiration dates regularly and rotating stock. And for more information about intranasal epinephrine as well as injectable epinephrine devices for anaphylaxis, read our emergency epinephrine devices chart. Now, the last 2 new products that I'll highlight today are approved as biosimilars, and we'll review what that means in a minute. But Merilog, or insulin aspart SZJJ, will be the first biosimilar to Novolog, or insulin aspart. And it's the first rapid-acting insulin biosimilar for diabetes. Like Novolog, Merilog will come in a 10 milliliter vial or a carton of 5 3 ml pre-filled pens. And again, Merilog is biosimilar to its reference product, which is Novolog. So that means that Merilog is shown to be highly similar to Novolog. It has the same dosage form, route of administration, strength, and mechanism. And it shows no clinically meaningful differences in safety, purity, and potency. Now, be aware that federal law allows automatically substituting a biosimilar for the original reference product if it's also approved as interchangeable. And interchangeable means that the product meets additional requirements for switching. But Merilog is not yet designated as interchangeable to Novolog. So if a patient wants to switch from Novolog to Merilog, or a payer requires this, you'll still need to get the prescriber's approval to switch products. You'll also want to consider cost and coverage when talking with patients about switches. The manufacturer of insulin aspart SZJJ, or Merilog, will offer it to all patients for $35 or less for a 30-day supply, and copays under some plans or in some states may be capped at $35 per month. And this is similar to other covered insulin prescriptions. Plus, right now, the wholesale acquisition cost, or WAC, of Merilog is about the same as Novolog, so about $70 per 10 ml vial or $140 per carton of 5 pens. If patients switch from insulin aspart or Novolog to insulin aspart SZJJ or Merilog, Advise a unit per unit conversion and closer blood glucose monitoring when switching. Also, make sure that patients don't accidentally get both Novolog and Merilog. Doubling up on insulin aspart could lead to severe hypoglycemia or dangerous drops in blood sugar. Another difference to mention is that Merilog comes in a solo star pen that delivers up to 80 units per dose, but Novolog Flex pen dials up to 60 units per dose. So that may be a consideration when deciding on a product if a patient needs these higher doses. And then the last med I'll go through today is omalizumab IgEC or Omlyclo. And this will be the first interchangeable biosimilar to Xolair for allergic asthma, chronic hives, and food allergy. But its approval is only for certain products and dosage forms. In particular, omalizumab IgEC is approved as the 75 milligram per 0.5 ml or 150 milligram per ml syringes, not the auto-injectors, vial, or 300 milligram per 2 ml strength. Expect that omalizumab IgEC will cost less than Xolair, since biosimilars often cost about 20 to 35% less or so than the original versions. But payers will ultimately drive the choice of which product a patient will get. Remember that you can automatically substitute a biosimilar that's also approved as interchangeable if your state allows. So in most areas, you can dispense omalizumab IgEC if the prescription is for Xolair. But keep in mind that many states still require you to inform the patient or prescriber even when substituting an interchangeable biosimilar, and a handful do require contacting the prescriber before substituting. So, good idea to always double check your state laws. If biosimilars are on your mind after hearing about Merilog and Omlyclo, we've got more for you. For a comprehensive overview, check out our resource called Facts About Biosimilars. You can find the link to this in the show notes. And for a deeper dive in audio format, give episode 13 called Biosimilars 101 a listen. And we're wondering, across all of these new twist medications that we cover today, have you seen any prescriptions for these yet? Or have you had any patients asking about them yet? Let us know using the Send Us a Text link in the show notes.
We hope you enjoyed and gained practical insights from listening to this episode. We've linked the resources we mentioned and more on today's topic right in the show notes. Those links will take you straight to Pharmacist Letter, Pharmacy Technician's Letter, or Prescriber Insights, where you'll find even more concise, evidence-based tools. If you're not yet a subscriber, now's the time. Sign up today to stay ahead with trusted, unbiased insights and continuing education. And as a listener, you can save 10% on a new subscription with code CC1025 at checkout. Also, be sure to check out our other TRC content, podcasts like Medication Talk and Rumor vs. Truth, plus our full Pharmacy Essential Updates webinar series for deeper dives. Thanks for listening. Stay sharp, stay current, and we'll catch you next time on Clinical Capsules.